I'm Dr. Ken Plaut to talk to you about migraine headaches, something I have a great passion for, as well as your normal everyday headaches. To understand what I do to help restore you back to health and get rid of those headaches, we have to look at the parts and how the parts work. This is a model of a back of a skull. It has little round balls on it that sit on the very first vertebrae that has cups. And it's a sliding, gliding joint, and if it gets stuck, it irritates the nerves that come off your spinal cord from your brain that go to arteries to your brain and face. Now, arteries are made of muscles. These muscles are triple layered tubes with nerves in them. So when the skull is offset, not moving correctly, it'll irritate the nerves that go to the muscles we call arteries, and we will have altered blood supply to the brain. Now, there's a hole in the back of the head here, right where the brain stem is, and one of the cranial nerves will come out of there and it goes to your stomach. So when we put it all together, if the skull is offset and not sitting right, whether it's from birth, sports, you're a kid, you're sleeping wrong, you got a phone in your ear, you're texting, or whatever the thing is, it's stuck, very typically the pain will come over the top on the side that it's stuck into the face and affect other cranial nerves. You can have pain in the eye, for example, and that nerve that goes to your stomach, you'll have nausea, it'll affect your vision. And what I do is a quadruple 4-part adjustment as fast as you can cough in a very short distance to reset the skull back on to the spinal column on the first vertebrae. That's how we get rid of migraine headaches. The frontal and rear of the head headaches are from the vertebrae the skull sits on. It very typically will get stuck in rotation, and it will also irritate that muscle we call an artery, but it'll cause headaches in the front and the back. People with migraines, the real severe ones that you end up in the hospital with at 3 in the morning for a Demerol shot, you're going to have both. So what I do is make sure I analyze how the skull is sitting, how that first vertebrae is, and we make a series of adjustments to correct that problem and get rid of it. There's no reason to suffer with that. I'm especially talking to you people who have had MRIs of your brain, you've been a pharmaceutical customer for years. Please come and see me and see if I can help you get rid of those headaches. And there's no reason to live that way. The last thing I'll do when there's a skull problem that causes migraines is check the TMJ. It also will get irritated as well. So it's the whole skull and upper neck complex that causes the headaches. When your health goes out, call Dr. Plaut.